Tonight on Let's Talk About Health, we ask the question, can we sleep with a bra?
And are man boobs breasts?
We also find out how we can reduce the risk of breast cancer. All that and more on
Let's Talk About Health.
Good evening, everyone, and welcome to this edition of Let's Talk About Health. We are talking about bras, breasts, and man boobs.
Okay, I like that. Man boobs. Yeah, well, it's going to be a very interesting topic, and we better be careful with this topic.
Yeah,
the jokes are going to be flying left and right. But I did catch up with Dr. Xia, and we went on the street, and we talked to some people and had some very interesting conversations. Boom, check it out. Look at me. I changed, and I'm in Novena already with Dr. Melanie. Amazing. Dr. Melanie, we are going to go out today, and we are going to test people's knowledge on breasts. True or false questions. You ready to roll?
Ready.
All right, let's go. I'll follow you. First question.
Yeah.
Can a bra prevent saggy breasts?
I don't think so. I don't think so.
True. True. Yeah, I would say true.
So the answer is no, wearing a bra does not prevent saggy breasts.
Why is it important to wear a bra if it doesn't prevent saggy breasts?
When the breasts move a lot, especially when it bounces up and down during sports, it's uncomfortable.
And so the next question is, can men get breast cancer?
No.
No. I think so. I don't know. I don't think so because they don't have the same parts as women that allow them to get breast
The
cancer.
anatomy and everything, you need all of it. You need all the parts. Okay, Dr. Melanie?
Yes, men can get breast cancer. It's not common at all. Less than 1% of breast cancers that are diagnosed in men.
Can men get breast reduction surgery?
Yes. True. I think yes. Yes.
Yes, it is possible to reduce the size of the breasts, even in men. Yes.
Women who have larger breasts have more of a chance of getting cancer. True or false?
False.
No.
And that is correct. The size of the breast doesn't impact your risk of getting breast cancer. Yeah, it's dependent on a lot of other factors.
Could it technically, if the breasts were very large, could then it maybe cause saggier breasts or not really?
It fall easily. I don't know. I don't have.
Oh my goodness, after watching that, I have so many more questions.
Yeah, right. You see the look on my face at the end there? Just that big grin. Yeah, it was. I was blushing all over the place. But the good thing is, for your questions, we have Dr. Melanie Xia here with us.
And joining up with the discussion, we've got Thavanesan and Koh Cheng Mun. Welcome to the studio, guys.
Hey guys.
Hello, hello.
Good to have you with us.
Thanks for joining us.
Thanks for having us.
Good to see you again.
Hi.
Hi, Cheng Mun. Hi, Tava.
Alrighty. I have, the burning question I have is sleeping with a bra okay? Because I've been told that you shouldn't sleep with a bra.
Me too.
No, well, I don't think I've slept with a bra ever.
Yeah, I
No?
don't think I have
Yeah, it's
either.
mighty uncomfortable.
It is.
I think in general, most women would find it more comfortable sleeping without a bra. But I don't think there's any issue or any danger sleeping with a bra.
Okay, so basically sleeping with a bra doesn't help with perkier boobs.
No, it doesn't.
No, it doesn't.
Unfortunately, not everyone would be sleeping with bras, right?
So then, what creates the saggy?
Gravity. With increasing age, you have ligament laxity. I think along with that, the skin also becomes more lax. And I think throughout life, many ladies go through many stages where the breast changes in size. For example, if you become pregnant, if you breastfeed, and so the frequent change in size, it increases, it decreases. Eventually, with age, with gravity, it will sag.
So the anatomy of the breast is a combination of muscle and fat, right?
I think this will help. Yeah, let's...
Oh,
Yeah.
yes.
Oh, wow,
Come,
that's
come.
a
Oh, she's
cross-section.
saying,
What
huh?
is a
Okay.
cross-section? Yeah.
I have two of them.
So you were talking about muscle, that's over here, that's in pink. And you were talking about fat. Fat actually is just under the skin layer, which is over here.
Right, okay.
And what you see in the middle is breast tissue, which comprises your breast milk ducts and breast tissue, the lobules that produce milk when you breastfeed.
Okay, so what about the yellow bit?
The yellow bits over here, I think, in this model outlines the fatty layer that's under the skin and also some of the breast lobules that's tucked in between here.
So what is the difference between women and men? Because we've heard the term man boobs. So do men have breasts?
Basically, the breast sits on your pecs. And the main difference is that women have a greater amount of breast tissue. Men do have breast tissue as well, in lesser amounts. So if you're talking about men boobs, it's an excess of breast tissue and it can happen anywhere near around the nipple area, or it can be as much as the entire chest area. Sometimes it may be on one side and at other times it may be on both sides.
Doctor, is it something that occurs from birth or like are there certain reasons?
Yeah.
Because my grandmother used to say that, you know, oh, because a baby consumes breast milk, you need to squeeze it out of the boy from young, so you need to squeeze the boy's nipple.
Okay, I haven't heard that one.
I wouldn't want to imagine what would have happened to my dad, but but just some, you know, misconceptions like regarding why like a boy or a man might have a man boob.
Right.
Okay, I think this one occurs more frequently at some stages in life, like newborns. During puberty, sometimes when there are some hormonal
Newborns get man
changes.
boobs?
Yeah, I guess in babies it's not as noticeable.
Yeah.
And then old age, during old age, and then it's also associated maybe with other conditions, maybe certain medication that you take, certain psychiatric medicine.
One of the questions in the video talked about men getting breast reduction
Yep.
surgery.
Yep.
Is that normal? Is that something
And do
that
they
men
come to
can
you?
do?
I think
Sometimes.
that's about the only thing that they want to reduce, you know. That's the only body part they want to
Right,
reduce.
Cheng Mun.
Yes, that's possible. Basically, what we aim to do is to remove the breast tissue, the excess breast tissue.
I didn't realize that guys were actually coming to you for treatment. And is it sometimes cancer?
It rarely happens, but if it does present, it usually presents as a lump again. So yes, there's a need to distinguish breast cancer in men from men boobs.
Alrighty, we're gonna go for a short break, but when we come back, we find out the message that 2 breast cancer survivors have for us. Welcome back to Let's Talk About Health. Today we're talking about breasts, and it's a very interesting topic, but we've got to also turn our attention to breast cancer. Cheng Mun, would you like to start and share with us your experience?
Okay, my journey with breast cancer. Well, it was a long time ago, about 17 years. I was diagnosed with breast cancer in 2005. It was early stage, so I was very lucky. Well, I had to change my lifestyle after the treatment, chemotherapy and radiotherapy. One big takeaway I got from getting breast cancer is to spend my time in a worthwhile manner, doing things that are worthwhile. Don't get too stressed up. Be grateful that you can wake up and you feel normal. In fact, breast cancer did save my life because during the scan to find out whether it has spread to other parts of my body, they found an incidental tumor in the kidney. If you discover it late, it's deadly.
What causes breast cancer?
Cancer is caused by cells that mutate. That means uncontrollable growth of cells. So the cells grow and grow until it becomes a lump that you can feel. Thankfully, most lumps in a lady's breast are not cancer. Many times you can have lumps that are fluid. These are called cysts. And you can have lumps that are solid that are not cancerous.
What about new moms who unfortunately have discovered that they have breast cancer? Can they, at that point, still breastfeed their child?
You should not breastfeed if you are on active cancer treatment.
Right, that would be the issue, not so much the cancer.
Yes, not
but
so
the
much the
treatment.
cancer, because you can't pass cancer on to your baby. It doesn't happen that way. But for the most part, if you are recently diagnosed, you would probably be on treatment. And because of that, you shouldn't be breastfeeding.
Right.
Yeah.
Okay.
Doctor, and how much of a cause are breast implants for like cancer and even other breast-related health issues?
The percentage of that is very small. A lot of ladies worldwide go for augmentation. Of course, you hear about things like breast implant-related cancer, but it's not common.
You know, they always tell women when you go for your health checkups
Yeah.
that you can feel your breast to see if there are new lumps or
Yes,
you know,
yeah,
anything like that.
yeah.
But is there any way to sort of feel what's a normal lump as compared to an abnormal lump.
How you can
or-
distinguish it.
Yeah, how do you can you distinguish it?
Okay, even when cancers present early, it's hard to tell. Is this soft? Is this lump hard? Does it move? Does it not move? Is this cancer? Is this not cancer? Anytime you feel a lump, and after 1 or 2 weeks the lump is still there, please come in to see me so I can double check it for you.
I think you're going to show us exactly how to check for lumps, right?
Okay, shall we do it now?
Yes, we
okay,
can.
Come, let's. Okay, so best time to do it is 2 weeks after your menstrual cycle, because just before that the breasts are usually sore. Most ladies usually explain that the breasts feel lumpy and it's very hard to distinguish whether it's a real lump or not. So you wait till after the period's over, and when you check, you usually check in 2 positions, standing up and lying down. Again, because lumps do move sometimes, and some lumps can be better felt when you're upright. A lot of ladies will do that in the shower. Other lumps can be better felt when you're lying down. So when you're feeling for lumps in the breast, I think the main thing to keep in mind is you want to cover the entire surface area of the breast, and you also want to include the underarm area, because that's where the lymph nodes are. And you would be feeling either just gentle pressure on your breast, you don't need to press really hard, or you can just sweep your hand along the skin of the breast. That will work as well.
Oh.
One of the ways that I would explain would be, say, if you imagine if you had a pea or a grape, and if you were to throw a blanket over it, and if you feel over that blanket, over the grape, that would be something like what you would expect to feel if you were sweeping your hand over your breast.
For men to check for lumps, do they do it the same way?
Yes, yes.
I guess we all have our parts we got to check and, and do it regularly. And so would you recommend just like, do you make it a habit, an everyday thing?
Once a month. If you have menopause, if you don't have a monthly cycle anymore, then you just fix a set date at the beginning of every month.
Is this still the same
one day
way?
maybe.
Do you put it in between and take pictures?
Mammogram, yes, unfortunately. Yeah, so...
But
Is it painful?
It's way faster now. The reading's very fast.
Is it painful at all? Or?
I would say on a scale of 1 to 10, it used to be 10.
Oh.
But nowadays, with the improvement in technology, it's about maybe 6.
The compression doesn't last for that long,
Yeah.
maybe under
What-
10 seconds.
What
Yes.
age
Yeah.
should Kat go get checked? I mean, not saying that there's anything going on, but should she be getting checked?
Yeah.
What age?
So if it's for purely screening, we recommend 40 and above, between 40 and 50 yearly.
Okay.
What
Just-
about before turning 40? How, if we wanted to get checked, is our usual health screening, yearly health screening enough?
Okay, so below the age of 40, there aren't any local guidelines to insist that you should have a regular breast screen, whether with an ultrasound or a mammogram. So under 40, you should self-examine monthly. That's the main thing you should do. And unfortunately, because breast cancer does happen, I think in ladies even in their 30s and 20s, although that's much more rare, the self-checks are very important.
Poor Thava over there. He's just like, okay, what question can I ask where I'm not going to get #MeToo?
It's not very often that we discuss like amongst the
Guys
dudes.
don't get to talk about this
Pretty
stuff,
much.
right?
Even guys who are facing those issues would not dare to speak in front of their fellow guy friends as well,
Yeah.
for fear of being judged.
I actually thought it was just a diet thing. I didn't realize.
Yeah, I used to think you can out-exercise or
Yeah.
outwork it, but
Right.
Maybe that's because of the misconception that breast is made of fatty tissue,
Yeah.
Yeah.
Yes.
right? Yeah?
Yeah.
Yeah, but it isn't. It's breast tissue, and I think how much you exercise, it will improve the pecs, but it will not eliminate the man boobs.
Well, thanks once again, Dr. Melanie. You're a wealth of knowledge. This is great.
Thank you for having me.
Absolutely. When we come back on Let's Talk About Health, we have 2 cancer survivor stories that we're going to share with you. And also, you're going to learn what it means to have breast reconstruction surgery. Welcome back to Let's Talk About Health. And we had the opportunity to meet 2 breast cancer survivors, and they have a message for us. Take a look.
Hi, Paul. I'm Lydia.
Hi, Lydia.
Nice to meet
Nice
you.
to meet you too. Come sit down. When people talk about breast cancer, the first thing you ask is like how much time you've got left.
The breast cancer, I think every woman will be scared on it. When you diagnosed with the breast cancer?
I was diagnosed with triple negative in December 2021. So just one day before my birthday, actually. So it was quite a shocker.
I was diagnosed in 2017 November. I was a ERPR positive, HER2 negative. Actually, my family is quite shocked because I was quite young. I was diagnosed with breast cancer when I was 36 years old.
You give me encouragement because, you know, reoccurrence is usually the first 5 years.
Yes.
So looking at you looking so good gives me hope.
No worries. Have you ever think of you will be diagnosed with breast cancer?
The diagnosis did come as a shocker because I have no family history of breast cancer, and I have been diligently doing my yearly medical checkups as well. But I was lucky actually because I do practice the monthly self-check, and I actually discovered the cancer lump on my own. What about you?
Actually, I was found the lumps by myself, but I dragged the treatment roughly about half a year's time.
Oh.
Because I think everyone will have a denial stage.
I remember when I was first diagnosed with breast cancer, a lot of people like to give me a lot of advice. Don't take sugar because it causes cancer, go on a vegetarian diet. As much as it's well-meaning, I think I was faced with a lot of information overload, and that really puts me into panic mode.
I have very terrible experience during chemotherapy. Nauseous and vomitings make you very sick and then very weak.
My side effects of nausea was actually manageable. I was fortunate that I made friends in the chemo clinic, and that support is very critical because when the moments you're down and your family members cannot understand why you're crying over losing hair because, you know, hair grows back. But a fellow person who's traveling or have gone through the journey, they understand and they help support you through the journey.
Most important thing is you have to keep your mind happy all the time. I was very proud on myself because I'm a breast cancer survivor.
Yes.
Yes.
What I would encourage every woman to do is, whatever it is, face life with a positive attitude.
Yes.
Really treasure and enjoy life to the fullest.
Joining us in this discussion right now is breast cancer surgeon Dr. Anthony Tang. Thank you so much for joining us, Doctor.
Oh, thank you for having me here.
Doctor, what do you first look at when you have a breast cancer patient?
Usually, the patient will go through a few steps, having some sort of scans being done, either the mammogram or the ultrasound, or sometimes both. Depending on the situation and all, they may need to get what's known as a biopsy done. In other words, we need to confirm what the nature of a particular lump is. Okay, and so a biopsy is a method in which we use certain devices to get a little bit of tissue from that area which we are a little bit concerned about. Yeah, and then from there, of course, you decide whether this patient needs surgery.
Is this what is used for a biopsy?
So this tool is a bit old, but even nowadays, most biopsy instruments are still based on this particular setup. Basically, all the biopsy instruments will make sort of like a sound, and so don't get too perturbed and disturbed by it.
Okay.
And then this particular needle, if you look at it,
yeah, my goodness, that thing looks very, very long. Tell me it doesn't go all the way in.
Sometimes it might go, partially.
Wow.
in. Okay, but obviously we are going to anesthetize that particular area, so the whole area becomes numb. And this needle is special in a sense that, can you see, there's a bit of a opening here. If I move the needle,
right.
So when you use this device, it pushes this part out, okay? So the tissue gets trapped inside, and then this part closes up.
Oh, okay.
So you trap a portion of tissue inside.
Okay.
There are other instruments as well which we use. Another one is called a vacuum-assisted biopsy. It's actually a bigger needle.
Okay.
But this needle can actually suck out the entire lesion. You're not sure whether you're going to be absolutely accurate with this device when the thing's really small. And so to be really sure, it's sometimes better to actually remove the entire lesion.
Subsequently, after the biopsy, how do you decide what is the next course of action, depending on the type of breast cancer?
When it comes to surgery, there are two forms, right? You can either do a lumpectomy. Lumpectomy is basically a removal of just the tumor itself.
Okay.
Okay, so it's a partial removal of the tumor and a little bit of the breast tissue as well. Okay, if you look at the diagram on the left, okay, where there's a little bit of a pink shaded area. So if the tumor is that small, we can actually remove just that portion of tissue. Yeah? But whenever we do a lumpectomy, the patient must do radiotherapy after that. We can remove up to around about 20% of the breast tissue and still reconstruct the breast so that it looks like, nothing has really been done. So if you need to remove more than 20% of the breast tissue, and usually you would be moving more towards what's known as a mastectomy. So a mastectomy is removal of all the breast tissue, which was image 2 before, right? And it's basically removal of all the tissue from here, this collarbone over here, down to here. So it's quite a large area. Wow. Okay, so we remove everything on the inside, but just keep the outside. We can fill that cavity with either an implant, which I brought along today, okay, or the patient's own tissue, which is called a flap, usually from the tummy.
Oh, okay.
So the lady's a bit happy, because it's a bit of a tummy tuck as well.
Yeah, don't want to lose your backside, right? Yeah, got that.
Okay. But are there any advantages to using your own tissue as opposed to using an implant?
That's a good question.
Right, yeah.
So obviously, using your own tissue, because it's mostly fat over here, it gives the most natural feel. Using your own tissue is always better than using an implant.
What material is being used for the implant?
The inside is silicone, so it feels very, very soft and natural, and you would think it's sort of like liquid.
Yeah,
Okay.
I thought it would be just like a thicker liquid.
Yeah, but it's not really. So if we made a cut on it, but please don't,
Yeah.
the stuff will actually stay in. So it's quite safe, even if it breaks. Everyone's a bit worried, will I get breast cancer if I put in an implant? So it's not associated with increased risk of breast cancer. But certain implants, like these ones, these are micro-textured, but in the past, they used to be implants with a lot more texture. It's a bit bumpy.
Yeah.
Okay? These are associated with a very rare type of cancer. It's called a breast implant-associated anaplastic lymphoma.
Oh, wow.
Okay, it's a long, long name, okay? Even to today, some patients get it because we didn't know it was associated.
They have it in from a long time ago.
That's right. So they had it in a long time ago.
Yeah.
Kind of thing. The treatment is quite simple, though. We just take out the implant and we take out a particular area around the implant, and that's okay.
Would treatment for cancer for a man be the same thing as breast cancer?
Yes, because the incidence of breast cancer in men is so rare. Okay, so basically treatment is the same as for women.
What would your one piece of advice be for breast cancer prevention?
My one piece of advice is for all ladies from the age of 40, whether you feel pain or not, whether you feel a lump or not, please go for your annual scans, in which actually 1 in 10 women will get, unfortunately, kind of thing. We can actually save lives and save breasts as well.
So I guess the bottom line here is always early detection. Ladies and gentlemen, you've got to constantly check for lumps.
Dr. Anthony Tong, thank you so much.
Thank you.
Cheng Mun and Thava, you guys are wonderful guests. We appreciate you.
Thank you for having us.
Thank you.
And you at home, check for those lumps, and we'll see you next time on
Let's Talk About Health.
If you enjoyed this episode, then make sure to check out our online series called We Need to Talk About This on MeWatch. Is dry skin and dehydrated skin the same thing?
Most patients that actually we see in Singapore have dehydrated skin.
So what do I have then?
You have dry humor, dry wit, and dehydrated skin.